my motive to become a disruptor was very ingrained in a mission, the mission that really brought us together, all of us at Medea Mind and at Balance with our companies. So to anyone who's looking at becoming an entrepreneur, especially in healthcare, I have heard this as a pattern, perhaps also from other founders. We tend to have a deep mission. So the problem, the issue that we're trying to solve really touches us closely, either as professionals, as researchers, or as patients, or as family members of a patient. So I think it's important that the mission, what drives you, is very deep, is very important for you.
Are you an entrepreneur looking to disrupt the healthcare industry? Do you want to stay on top of the latest innovations and trends in the world of health and wellness? My name is Gonzalo, and I welcome you to this brand new podcast titled Healthcare Disruptors, that explores the intersection of entrepreneurship and healthcare. In this series, we will be talking with entrepreneurs, experts, and CEOs who are revolutionizing the healthcare sector through cutting-edge technologies, products, digital services, and much more. Healthcare Disruptors is brought to you by the EIT Health Innovators Community, a network of professionals who are passionate about revolutionizing the healthcare industry. Join the community today. Welcome to this new episode of Healthcare Disruptors. Today we are thrilled to have here Sara Zangri of Medea Mind. So Sara Zangri is improving access to quality mental health care through science and technology as CEO of Medea Mind, and she is also PhD researcher at the University Complutense of Madrid. Welcome to the episode, Sara.
Thank you for having me. It's a pleasure to be here.
Good. Let me introduce also your company to the audience, and later you can introduce yourself and your company. Well, Medea Mind is the first multimodal triage system to improve clinical outcomes in mental health. So welcome Medea Mind. So please introduce yourself and your company to the audience.
Thank you so much for your introduction. I think you covered quite a lot of the things that I do, but I will try to briefly give you maybe some off-the-record insights. So I am a PhD researcher. I've been studying and working also as a clinician, as a psychologist for the past 10 years. I started my studies in the UK, but then quickly moved to other healthcare systems. I'm originally from Italy, so I had some experience there. I crossed over to the US. I studied at Harvard University at the Massachusetts General Hospital, which is where I began thinking about entrepreneurship as a possible way to overcome those barriers in scientific transference into clinical practice. So that's a bit of where my journey as an entrepreneur started. I wasn't planning on it. It's one of those things that happen in life when you identify a problem, when you see something that you might want to solve and find no solutions for it. So that's where the idea for Medea Mind started shaping in a way, and it could not have become what it is today. So our company, without my co-founders, especially in that context, in that moment of my life, while I was in the US, I crossed paths with Dr. Pablo Roca, who's my co-founder and scientific director at Medea Mind. He shares my same clinical background. He's a PhD in psychology, and we worked at the same lab at the University Complutense of Madrid, where we met originally. And together we began, sharing those frustrations of our profession as our clinicians, where we often have several barriers that we cannot overcome with technology, which is something that in other healthcare fields is something now that is part of routine care. So you have technology to help clinicians, technology to help patients, but in mental health care, we are lagging behind. So that's the moment where the idea of could we do something about this began getting shaped.
And you talk about the problem, because I've been reading that you have to fall in love about the problem instead of your solution. How important do you think that it is falling in love or trying to fix this problem instead of working on the solution, but because at the end the solution should be the fix for the problem. How important do you think that it is for a startup?
Well, I can tell you from my experience, for our case, the problem was everything because was the origin of wanting to become entrepreneurs, of wanting to find a solution. But the problem was something that we faced in our everyday practice. The problem in mental health care is the lack of clinical efficacy that we see for our interventions, for our treatments for patients. We know that around 70% of people do not receive the appropriate treatment for their mental health problem. And of those who can finally access treatment, 1 out of 2 do not improve. So that lack of clinical efficacy is the thing that motivated us to become entrepreneurs, to found Medea Wellbeing, that is the company that gives origin to Medea Mind, our software solution, but also to Balance. Balance is a mental health clinic that we have here operating here in Spain, and does so with a multidisciplinary approach where we combine psychology, nutrition, and physical activity interventions to help people care for their mental health through prevention, promotion, and treatment strategies. Everything digitalized to improve access to it. So as you can see, the solutions can be multiple. In our case, we found 2. We got a branch that is a software company that we have through Medea Mind, and the other side that is clinical interventions digitalized. So I think the problem and falling in love with the problem has to be everything when you start your entrepreneur journey.
And do you have already results? And I mean, it's 2 questions. I have 2 questions. One of them is if you have already results of these clinical evidences about your tool, and also how do you fix these clinical things that don't work to the past?
So the lack of clinical efficacy, the origin for the lack of clinical efficacy can be attributed to many things. From our experience as clinicians and researchers, we believe that the true reason why we lack clinical efficacy starts with data. So in other fields, for example, in precision medicine, you see that a multidisciplinary approach has brought improvements in clinical efficacy. A multidisciplinary approach means looking at multifactorial data. So not just what has to do with pathology, but also lifestyle interventions, context, everything that surrounds the patients in a way. And that has been used to improve precision treatment, outcomes, monitoring of the patient. But we don't have something like that in mental health care. Professionals like myself, like Pablo, like our colleagues, we face several barriers when it comes to data processing, data visualization, and everything has to be led by data if we want to have precision mental health care. So that is the thing that we believe we can bring through our software, a precise evaluation, treatment, and monitoring of the patient, something that through technology can accompany patient and professional to make sure that that data is constantly processed, visualized, and used to inform treatment. And that is what we believe to be the way forward, not just because we think so or because science says so, because we have seen it in other fields. For example, as I was mentioning, precision medicine.
Yeah, you are talking a lot about efficiency data, and I've been reading some things about your company and about that you use big data, AI. You have like software as a services. You are talking also about media mix. Can you tell the audience how you put all those pieces together in order to provide improvement to the patients and to the clinicians?
Absolutely. I could walk you through the patient journey and the professional journey that perhaps might be a way to better visualize it. So let's say that you're a professional in this case, and you come to my consultation. Generally, I would need about 3 hours of a thorough evaluation to make sure that I can get a profile, a screening of what your needs might be. That initial screening then will be the key piece of data that will guide my treatment plan for you and will be the first measurement that I will use to actually evaluate whether my treatment is being effective, let's say. And that initial screening that generally takes 3 hours through our software can be done in about 10 minutes. So we get an input of data from the patient, that gets quickly processed and communicated to the clinician through our AI system. The AI system doesn't just provide this initial screening and interpretation, it also gives a different interpretation to the patient. So it creates a bridge, a visualization, we call it dual visualization, that can provide a first point of communication between the patient and the professional using data, using visualizations that are clear, that are compassionate also towards the patient. So we use different language when we speak to the professional or when we speak to the patient. All of this first point of the system is driven by the Medea Mix. The Medea Mix is an instrument that was created by Pablo and our scientific team at Medea Mind, where we looked for a way to create biopsychosocial profiles of our patients. What does that mean? So we say that mental health, we believe that mental health really does not rely only on the data measurements of pathology. So if we just measure pathology, let's say your depressive symptoms, we're missing out all of those important variables that can actually give us a deep understanding of how those depression symptoms arise and must be tackled throughout treatment. So there is already great evidence coming from neuroscience showing that the brain-gut microbiota axis plays a key role in pathology such as depression. We also know that the way a person moves, their embodiment, cognition, plays a key role in mood and mood disorders. We know that physical activities interventions, for example, have been a way forward now in research to intervene in cases of treatment-resistant depression, for example. So all of these variables that have to do with lifestyle intervention, that have to do with habits, generally do not get collected in this initial screening. This is something that we wanted to change. So the Medea Mix collects a series of variables that have to do with habits and pathology in 3 domains that we believe to be key for mental health. So we have psychology, we have nutrition, we have physical activity. But then after creating this initial screening, we thought, what about the person's context? That must play a role in how the treatment might develop or how the person might respond to it. So we also included a 4th domain that is the person's context. So their work environment, the place where they live, their social relations, and all of these variables get very quickly processed with just a 10-minute screening. Now, the screening doesn't substitute diagnosis, of course, but in just 10 minutes, we can give the professional all of those tips, all of those hints on how to go in then in a precise diagnosis. So this initial step can save us that initial screening time that the professional would have to do during those 3 hours. And that same screening then gets used for the ongoing monitoring. So the system then routinely collects information again and processes it in order to give information to the professional, how the treatment is going, and also to the patient. Because I think this is really important to remark. In mental health, our patients, although we call them patients, right, they must have a key role. They must have an active role in treatment if we want them to improve. And we believe that this initial point of visualizing, of understanding, of having an open communication and actively engaging the patient is extremely important because it's not the same, let's say, type of treatment that we would see in medicine, for example, where the patient's engagement is important, but it doesn't have quite an active role as we observe in mental health. So we believe that the software really creates a bridge. It sets a pathway for patient and professional to walk together along those steps that are important. So a good screening, a good diagnosis, and then treatment supported by digital tools. We include that as a 3rd module of our software because we know that in between sessions, it is important for the patients to be able to practice the things that they have learned in order to also reduce the costs of treatment. So the 3rd module would include a personalized treatment plan that the professional can design and make sure that the patient receives all those digital tools that might help them improve quicker.
Yeah, I mean, there are 3 topics that I see from here that I would like to talk and to let you share with the audience. One of them is the technology side, because at the end you've built so far so many technology. The other one is the different treatments of mental health that you have into the media, and also the third one is like the active role. So I mean, how the engagement with the patient is. So maybe we can start with the kind of treatments that you have in your tool, and later we can jump to the technology and to the engagement of the user or any other topic that will.
Perfect. So the objective of Medea Mind is to be the first software with a biopsychosocial and transdiagnostic approach. So I will break those down for people in the audience who might not be familiar with it. So biopsychosocial is what I was mentioning before. The type of data, the type of variables that we collect are not just restricted to pathology. So we look at the broader spectrum of symptoms and habits and collect all of that information throughout treatment. And then it comes to the transdiagnostic part. So there is a movement now in psychology, in research and clinical practice that is vouching for a different type of treatment approach that is not categorical, not just diagnostic, because there are no two people who have the same profile of depression, for example, right? So we know that they may share, however, symptoms of depression. So when we look at those symptoms that are common among different mental health issues, that's when we can provide more effective treatment, especially because in mental health, we see so many cases of comorbidities. It's not quite as clear cut as in cancer, for example. A person may have cancer, may not have cancer. In mental health, we have symptoms of different intensity and different impact on functionality. And in that case, we know there's a new theory. I won't go into too much detail of it, but there's a new way of analyzing and visualizing mental health problems that comes from the transdiagnostic approach that can be visualized through network analysis. So we'll see different networks of symptoms in this case and observe the relations between them. And that's something we say very pioneer in our software that we are providing professionals, because we know that that's something that in research helps us understand how to tailor better treatments, but it has not yet been translated to clinical practice. So it is a way to better serve the professional to understand and lay out a case formulation that they can use to guide their treatment, and to provide that information also to the patient so that they can become aware that, for example, my symptoms of depression, they are connected to my sleep problems, they are connected to my gut health issues, they are connected to my social relationship issues, and perhaps to my lack of physical movement. And if I don't tackle all of those symptoms, perhaps that's a reason why I'm not getting better. Perhaps that's a reason why I'm having continuous relapses. So understanding that really engages the patient at a different level. And we believe that that's a way forward to improve that adherence to treatment. That unfortunately, mental health is also a problem. Since people do not improve that quickly, and we have no way to show them that those small improvements are actually happening. Very often the patient either leaves treatment, believes that the treatment is not working, or just loses hope. And we don't want that. So we believe that through that technology, through that different approach for treatment, we can provide patients all of that information that might actively engage them and make them adhere to the treatment.
Okay, understood. And my question now is I'm going to mix the technology side and also the engagement of the patient, because at the end, you both co-founders are researchers, and you've built a digital tool, I mean a technology tool. So my question is, how difficult for you guys have been building this tool in order to provide to the physicians and to the patients the information that they need to improve the treatment and do treatment adherence. And what is the most difficult part of engaging the patient? Because at the end, when you have mental health issues, maybe you don't want to be focused on your symptoms or on your disease. So how you find the balance between you being researchers, focusing on technology or managing the technology at the same time to manage that the users want to be are engaged into your tools? How do you make it happen?
That's a fantastic question. It is one of the issues that if anyone listening is building any sort of digital solution in healthcare, this is the number one thing that you should consider. And I will connect it to what you asked me before about the problem or solution being the central focus. So the same way that we should focus more on the problem than on the solution, because there might be different ways of carrying out that type of solution, we have to also put the patient and also the healthcare provider, if they're involved in the technology, at the center of our design. Because as much as, for example, Pablo and I might want to put different type of science-based solutions within the software, there might be things that are not quite necessary for the patient, although they might be very cool for the professional to use, and the patient might just not engage with them. So patient engagement within technology is probably one of the hardest and most important things that should be considered in the design stages. And we believe that in our case, we're quite lucky because the technology serves the professional and the patient. So generally, if it's, let's say, a digital tool that your professional is prescribing, where you have good working alliance, where you trust the professional, it will be easier to adhere and to use that type of technology. We believe that that's an issue also for many of those healthcare solutions, especially in mental health, that are just technology based and are not connected to a provider. So in that sense, we overcome one of those steps, but we definitely included both professionals and patients within the initial stages of our solution design. So we carried out interviews. At first, we went through the wildcard program in 2022. We're one of the finalists in the mental health challenge. And through that program, something that we learned that we believe to be extremely valuable in what is Medea Mind today was exactly that initial stage of the interviews. So we interviewed patients, we interviewed professionals, we interviewed healthcare providers who might come into contact with a mental health patient at some point. So not just psychologists or psychiatrists. We also spoke to GP, to nutritionists, to pharmacists. We really tried to speak to as many people as possible who might give us insights into how this technology might become useful or not, or it might just become another extra thing for the professional to use or another extra thing for the patient to have to use. So we wanted to really make sure that the patient needs and the professional needs were at the center of the design of Medea Mind. And that was the challenge for us because it's not just the patient here, it's also the professional has to use the technology. So we have a double-edged sword there between the things that are clinically useful and the things that will be engaging for the patient to use. So at this stage, I can tell you that the first trials that we had have been successful for the professionals and the patients, but there's still a long way for us to want to improve our software, improving UX and engagement, and really to learn. We believe that in the next few years, we will be learning and actively listening to our users, to patients and professionals to make sure that we can best serve their needs. And the one thing that I believe in our case has been a key to a successful design of the software solution was to openly listen, to not put our ideas and what we believe, because of course, coming from a science background, we knew that we had the answer. We knew that the solution had to include all of these steps in the patient journey, starting with screening and treatment and monitoring and so on. But we wanted to test them one by one. So we first started with the Medea mix and truly try to understand, okay, how is that useful for a professional? How is that useful for a patient? How much information do we need to give them at this initial stage, right? So this learning and iteration process, module by module, was definitely useful in understanding how to apply that technology. And perhaps the biggest challenge is how to make that technology fit into what the professional's day-to-day life is, which is definitely another challenge.
I really love your approach because I think you did everything you had to do in order to at least being close to be a successful company, because at the end you talk with all the different stakeholders and you were trying to validate your solutions one by one. So I think that many people in the audience that want to run a business company in the digital health, maybe they can follow your path, your steps, because it's really great to know how you did it. And also, I mean, I think that you maybe you open the mind to the audience. And I would like also to ask you about the different acceleration programs, because you were talking about the one of the EIT Health, but I also read that you won a hackathon in Spain, of InnoMaker for Health. You also have been in touch with Unlimited Spain, the EU, Fundación Más Humano. So, what was the biggest help that you achieved so far to become what you are right now? That maybe can provide lights to the audience.
That's a great question. So, being an entrepreneur in healthcare, especially coming from a research background, which seems to be the case for a lot of our colleagues in this space, is a great challenge. Of course, then I count with a third co-founder who was an expert in business and finance, and our team has been growing over the past year and a half of working at this company. But the thing is, you can't do it by yourself. It can't be just you and your co-founders or your extended team members if you have the luck of starting with team members, right? Because most people start just themselves or a co-founder or two. So in our case, we really try to get help from the network. We know that bringing in a solution to life in healthcare is very tough, it's challenging because of funding, because of all the regulatory pathway and lack of clarity of regulatory pathway in software especially. So I believe that getting all the help we could became our mission, especially my mission. So after the wildcard program, we had a fantastic experience there in learning, in challenging and tough conversations on occasion with our mentors. But all of that really helped us identify all of those barriers that we might encounter, identify our weak spots also, and where we had to work both personally and professionally or within the company. So we looked for more of that. We look for more of that, especially in Spain, because our solution will be launched in Spain, will be commercialized in 2024. We're currently running all of our trials to go through the regulatory bodies. And getting that help was crucial, was essential. I couldn't tell you what was most helpful. I could say that from perhaps a more personal point of view, I believe that when more negative things happen to me in life, I tend to react best afterwards. So I do really tend to learn from challenges and, let's say, unsuccessful moments. They really are the ones that push me the hardest, but that's more of a personal level. I would say for our team, definitely programs where there was a focus on healthcare were the most helpful. So far we are also incubated. Well, a part of the of two different healthcare programs here in Spain. We're helped by Unlimited Spain. We're doing a fantastic job. They're put in contact with Lilly, the pharmaceutical company here in Spain, and they're giving us great help to understand how a solution like ours perhaps might be brought into the public healthcare system. So as part of our scalability plans in the future. So we're really trying to learn as much as we can from every person that we come in contact with. From the community of Madrid, we're also incubating in the Health Start program, where we're speaking to experts who work just day to day with companies like ours in the public and private healthcare sectors. They help clinicians who have an idea bring it to market. So I definitely would say that the most helpful moments have been the hard moments where people may have said, perhaps, okay, but this solution, how would you implement it in the professional journey? Or really challenging the ideas and the science also that we had behind it, because science doesn't always translate well into clinical practice. So all of those, let's say, tough criticisms moments were the most helpful for us. And we hope to keep getting them. So to all of our mentors who might be listening, I'd say that just keep on giving us the tough talk, because that's very helpful.
Yeah, and you talk about two topics. One of them was the regulatory side, that it can be just a conversation about it because it has many burdens. And the other one is like when you have like difficult moments, and also you as a CEO, you are a woman, and maybe we have some women in the audience that are running a company. So how difficult was being funded to get money on Medea Mind, being you as a woman a CEO, and if you can give some tips or something that can help to the women to that are CEO to get faster or whatever you think is important for them that you didn't know it.
I was listening about this piece of research that I won't go into details because I don't have a reference, and that's something I don't quite like, but I'll just say it anecdotally, that women tend to take less risks, right? So it seems to be that just because of our growth and development, tend to be criticized more through early adolescence. It appears to be, again, no reference here, but I do believe that that might have something to do with the way that we might strive for perfection in a way, to be really tough on ourselves and to take less risks. I can observe that. I don't know if it's a personal or gender driven situation, but even with my co-founders, I might be the person who is less leaning to take a risk sometimes. Although we do take every decision as a team. We take it on as a team, especially the important ones that come to funding. And I would say that one of the difficult moments that we had over the past year, although many private investment funds have come close to the project, we've had several conversations, and we had good conversations with a lot of them. So far, we wanted to use just public funding and grants to build our MVP, to do our testing, and go through the first steps of the regulatory pathway. So that's something that perhaps is less risky, perhaps might be a slower type of development. It is a tough choice, but it's the one that we believe was the best one for us at this stage. Of course, in the future, we will also be open to a funding round from private equity. But for these initial stages, to really understand the product market fit, to do our testing driven by science with our own times, we wanted to go through this pathway. So I don't know if there's a gender-driven variable in there, but at the same time, I can tell you that it might be a tough choice to make, because when you get given perhaps the funding to hire that extra person to go a little bit faster, that's a very tempting moment and a very tempting solution. But we decided that was not the right one for us at the moment in time. Although being an entrepreneur is risky. So I would say there was a very good example of women also take on risk-taking behavior. And in my case, being the CEO, it comes with a lot of responsibility and a lot of learning, especially coming from a science background and not a business one. But I would say to women who might be listening, they have an idea, they want to become entrepreneurs. If you feel those emotions that might be anxiety or fear, that might be driven by that, oh, will I not be able to do it well? Or will I be successful? Or will I fail at this? All of these emotions that make us doubt our self-worth or make us afraid also of other people's judgment, they might have some gender role in there. So to those people who might be listening and experiencing this, I would be happy to say, try it, give it a go, ask for help, ask anyone from the environment, the business environment that you want to walk into, the ecosystem, for help. If they want to get in touch with me, I'll be more than happy to provide my help in any way that I can. But I think it's important for women to also take risks. So do go ahead, do try it, do fund your company, do try your small version of the project. I think that's the advice that I would give.
Good. I love your advices regarding about validating and going in baby steps instead of running. First baby step, validate your idea with the market, and later going a step further. And also, you were talking about a lot about regulatory, and the thing is that you are building like a product for the future regarding what you said, and also you are talking about your path, your career with Medea Mind. So to me, and it can help me and the audience, it's like what was the biggest mistake with the company that you made so far? I mean, it could be regulatory or it could be whatever. What do you think that? So maybe if I come back 2 years ago, maybe I wouldn't have done it like this.
Oh, that's an interesting question. I think I'm afraid that talking about fear, that the mistake that we might be making right now will lead me to thinking that in a couple of years because we're just still at the beginning stages. So looking back, I can tell you that there are several things that with the hindsight that I have today, maybe I would do differently. For example, certain things that we decided to include or not include into our development. All of the learning that I was telling you previously of different mentors and things that we could definitely have done better, faster, more successfully, but we didn't have that information at that time. So I really tried to tap into my own mental health knowledge and management in these moments, because as a CEO, especially, all the decisions that you make constantly, they can have several negative consequences right in the future. But if you concentrate on that, that's not going to be helpful to make those decisions. Instead, what I try and do is to really assess the situation in the present moment, and with the resources, with the objectives that we have right now, try to make decisions that give me peace for this moment in time. So something that perhaps looking back, I would say we could do better as every startup is to manage our operations better, because we take on so many projects, we take on so much work. We're really hard workers. My team and I, we love what we do. Honestly, it's not a thing of, oh, we want to work a lot, we want to just push ourselves. No, it's just that we find so many projects interesting. We have several collaborations with public hospitals and private mental health companies here in Spain and internationally. And we keep on taking on things, but at some point it has to come to the point where you just have to stop and manage your operations just with the essentials and most important projects. And that's perhaps the hardest thing that we're still learning. Try to say no and try to prioritize those things that are most essential for our business.
I love it because you provided the audience with the tip that is trying to prioritize yourself and say no. That is also good as a mental health advice, and at the same time, you talk about that you took the same, I mean, the best decision with the information you had at the time. So at the end, you can complain. And you were talking about where do you wanna be in a few years ago, because you are going to be into the market in 2024, as you said. But where do you see yourself as a CEO or as a Sara Zangri and your company maybe in 2030?
2030. Okay, so I have an objective. I have an objective that is also a dream, that is also something that is part of our core missions and values. We want to make sure that quality mental health care is accessible to all people. And in order to provide people with a solution that is effective, with professionals that are not saturated and burnt out, we must provide them with something that eases the burden that they have currently. And the place where most burdens are present in that context is public healthcare, especially in countries like Spain, where we are lucky enough to have public healthcare. In terms of mental health, unfortunately, compared to other European countries, in Spain, we don't have enough clinical psychologists per person, which is something that I know that will have to change in the future. It's not something that can only be eased by technology, but I would love in 2030 for a solution for Medea Mind to be present not only in Spain, but perhaps in Europe, perhaps over Europe. That's another objective of ours, not only the US, but Latin America, where we see that mental health is also undergoing a revolution where professionals are really advocating and people are also seeking mental health solutions. So my objective and my dream in that sense for our company is to be present wherever professionals are working, public or private sector, to give them those tools to be able to provide effective science-based treatments to all their patients without the burden of having to do all of that work manually themselves.
I love it, and I think that you are in the right path, in the right way, because I read an article where you are part of the 15th Spanish companies most promising in mental health in Spain. So congrats for it.
Thank you.
And also, I mean, as you know, we are getting the end of the conversation, and you know that the name of the podcast is Healthcare Disruptor. So what do you mean to be to you being a disruptor, or or why do you consider yourself as a healthcare disruptor or a disruptor in general?
This that I'm about to tell you is not mine, right? This is something that was told to me during one of our mentoring sessions, but it is both something that we're proud of and our biggest burden and pain as a company. We're not improving the road; we're building the road. What we're doing at Medea is not simply digitalizing something that is already present in clinical practice. We are providing a new way for professionals and patients to undergo mental health treatments and to provide mental health treatments from the professional side. So that comes with a lot of challenges. It is definitely harder. It comes with a lot of uncertainty and added difficulties, but it is also a wonderful, exciting adventure that we're going through. So I would say it's equally exciting and scary at the same time.
Good. And also, I mean, because now there are like many more digital companies after the COVID than before, and also maybe what would be your advice to someone that want to build something like you built regarding a company in the digital health ecosystem, and that someone who wants to be a disruptor? Because to me it's like I've seen you as a disruptor because you you put the foundation of your company really well. I mean, interviewing people and not just patient, also clinician, also trying to do the validation in baby steps, trying to grow one step further, but not two. And also, you know where you want, what you want to reach in a few years. But nowadays, if you would find someone that want to follow your steps and to be and want to have a company or to be a disruptor as you guys are, what is your advice to this someone?
This is a very tough question for me because I didn't plan for this to happen to me. It wasn't my plan. Honestly, I was very focused on my academic and clinical career as a clinician, as a psychologist. So becoming an entrepreneur was more of a need at the moment when I wanted to have something different from my clinical practice, not just for me, but for my colleagues and for all possible patients. So my motive to become a disruptor was very ingrained in a mission, the mission that really brought us together, all of us at Medea Mind and at Balance with our companies. So to anyone who's looking at becoming an entrepreneur, especially in healthcare, I have heard this as a pattern, perhaps also from other founders. We tend to have a deep mission. So the problem, the issue that we're trying to solve really touches us closely, either as professionals, as researchers, or as patients, or as family members of patients. So I think it's important that the mission, what drives you, is very deep. It's very important for you because the path it doesn't come without challenges. It's definitely challenge filled. And at the same time, I would say that when you have a mission, when you have something that drives you through those difficulties, it's easier to find solutions. It's easier to go and really speak to other people and connect with them and make them hear that what you're doing has purpose. So for me, definitely having purpose will be a key factor to becoming a disruptor, to becoming an entrepreneur, to becoming anything a person might want that comes with challenges.
Yeah, the end is like taking or do the zoom out and trying to don't push and don't force anything. It's like I see yourself because you didn't plan nothing ahead as you are now the CEO. Even you started being a researcher. And also, this is more a personal question I'd like to to share with the audience. It's like what 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 could you set to your younger self? I mean, I don't know if when you were in the university, when you were at school. So what can you say to this kid or this younger self? Just an advice that maybe can provide something to the inspirational to the audience.
Well, well, I would definitely tell my younger self to be patient and be present in the moment. I've always been a person who looks those two steps ahead. So instead of concentrating on what I'm doing right now, for example, in my degree, I was already looking at my master's, already getting into the master's, and after the master's, then into my PhD, and was doing my clinical practice, looking at the research and publishing, and also within the company. I mean, this now really fits my role because I have to look ahead and make sure that what we're doing right now will take us there in those 2 years' time. But for my younger self, I would say enjoy the moment, be present in the moment, and really savor those happy moments and also the less happy ones because a lot of learnings come from it.
Good, good. So thanks a lot for everything you shared. Now is like the open space that you, as Sara Zangri, as CEO of Medea Mind, has at the end of the podcast to share whatever you want to share that you haven't shared yet, or whatever you want to reach from the audience or to the audience. So it's your time. Take your time. Say whatever you want, and we are going to be happy to hear you.
Thank you so much. I would definitely focus on a thing that worries us as researchers and as clinicians in mental health. Mental health issues are the biggest burden that perhaps our society will face in terms of healthcare. We see the high prevalence of mental health issues in adolescents, but also in adult population. We've observed the spike in mental health issues following the COVID pandemic, but we see that there is something within the way that we live our lives and we lead our society that is making people suffer from mental health issues. Very often we wait for that issue, for that problem to impact our functionality, to ask for help. And I want to ask people, why wait? If you get your medical checkup once a year, if you get your blood test done, also try to take care of your mental health that way. Do get your mental health check. You don't have to wait for the moment where everything feels like it's crumbling to ask for help. Mental health is something that we have all the time. It exists on a spectrum. So we have to make sure that when our mental health is good, we do things that boost it and keep it well. But also when we feel like it's declining, we take those steps to bring it back up. We believe that at Medea Mind, we provide patients and professionals with the tool that they need to make sure that all patients can get, all people really can get that mental health check. And if needed, they can be led into a treatment path that they need at every point in time. But also with our second line of business, with Balance, our digital clinic, we take care of people's mental health and promote good mental health and habits through digital interventions. We're doing everything we can from our experience as researchers and as clinicians to provide people with those tools that they need to care for their mental health and to provide for a society where better mental health can be definitely beneficial for all people. So to anyone who's listening, this might be your second of reminder to check for your mental health this week, to make sure you check on those people around you, whether you're the CEO of a company, check on the people who work with and for you, whether you work within a team, check on people on your team. It is important that we also boost that social component of mental health care that we believe is so important and has been very often left behind. it is part of our company culture to take care of our own mental health and that of all of our team. So I hope that this moment can provide for a small reminder for other people to do so as well.
Do your mental check. I do it and I love it. And I love it. So thanks, Sara, for being here with us, sharing everything you share with us, with the audience. And also, I enjoyed a lot this conversation with you. I mean, from the philosophical point of view, from the mental health point of view, and from the personal point of view. I wish you a lot of success individually and also for your company, for Medea Mind. So happy to having you here. Thank you very much, Sara.
Thank you so much. It's been a pleasure. Thank you.
Visit community.eithealth.eu to join our community and shape the healthcare landscape with us. For more such videos, subscribe to our channel.